Welcome to Adapt NCLEX. In this video, we're going to walk through 85 NCLEX practice questions that covers multiple systems from prioritization, medication, laboratory, maternity, case study, and more. This is designed for NCLEX test takers because it's packed with what? Must-know content commonly tested. This is a special one among all the 85. This is the one you want to watch. Treat this like a mock exams. Answer it with me, pause the video, pay attention to the keywords, and keep your score. Let's start with the first question. It's a prioritization. Every time you see a prioritization question, remember Adapt NCLEX. The approach. What do you need to do? Read the question. Which client should the nurse assess first? That means all of them have a problem. You got to choose which one you want to assess. How do you do that? And then arrive at the scene of the motor vehicle accident. This is a triage, right? It's a triage problem. Who do you see? Somebody you can save their life. If you're already dead, you're dead. If you can save them, let them go. What do you see? Clients with multiple whole body, laceration and crying. Okay. A client with large scalp laceration and active bleeding. A client who is confused and repeatedly asking what happened. A client who is restless, clammy skin, and rigid abdomen. If you are the same, who do you want to see? How do you approach the question? Like I said, pause the video, select your answer, and then see the way I'm going to approach it. But pick an answer, and then we can go through the steps. I know you picked the right answer. So how do I do this prioritization question? Divide the thing into two and figure out what is the situation. Multiple whole body laceration and what? Crying. Large scalp laceration, active bleeding. Patient is confused, is asking a bunch of questions. Patient is restless, clammy, and what? Rigid abdomen. I can tell you the right answer is D. Why? This patient is sick, is in what? Shock. At the same time, may have some issues in the abdomen, peritonitis, rigid abdomen. This may be bleeding. That's why the skin is clammy. And the patient is restless. When you are in shock, you can exhibit some airway issue. These are all buzzwords I have in the B sharp. I will link a prioritization strategy in the video and you can watch it. Why is the other ones are not right? Well, multiple whole body laceration, you're crying. So far as you're crying, your airway is intact. Wrong answer. Large scalp laceration, this one is a trap, NCLEX trap right there, active bleeding. Well, scalp laceration, you're not going to die from it. It may need some pressure, right? But it's a bleeding, it's an active bleeding. But if you change the word active, you're missing the point about triaging. This patient is sick, confused, repeatedly asking what happened. Probably is basically disoriented. GCS is not normal, but hey, it's not dying. Asking question, airway is intact. Like you can see, if you're talking, your airway is intact. Therefore, number 4 is our best answer choice. And that's the patient we're going to see. Next question. Which client should the nurse see first? Maternity health nurse plans home visit for the day. Which client should the nurse see first? A client who with diabetes will report numbness and tingling in the feet for 6 months. A postpartum client who is 2 days after delivery and report passing large blood clot. A client with what? Hypertension who mixed 1 dose of a medication yesterday. A client with chronic osteoarthritis requesting a refill of the prescription. Who are you going to see? These are our 4 patients. You are a community nurse. Once again, stop the video, select your answer. When you lock in, then you play the video. I give you 5 seconds. You pick one? Yes, you did. Which client should the nurse see first? The right answer. What do you think? Let me break down the question first, and I'll give you the right answer, and I'll explain why each one is wrong so that you can take a note. One, how do you approach it? Go for the buzzword. Diabetes. Okay, what do you report of? Numbness and tingling of your feet for 6 months. We have a problem here, 6 months. Well, I can't fix the problem right now. You have diabetes. What do you think? Client who is 2 days postpartum, large blood clot. Hypertension, you miss your dose of one medication, just one dose. Osteoarthritis, what do you complain about? You need to refill your pain medication. Well, as you can see, the only person that is more dangerous is somebody who is hemorrhaging. That's B, and therefore that's the one we're going to see. That one is bleeding still. After being discharged from the hospital, your blood clot should go down, but she's still having large one. That's hemorrhaging. Diabetes patient, you have peripheral neuropathy. I can't do anything about it. 6 months ago, I'll see you later on. Hypertension, you mix your dose, we will give you another dose. Osteoarthritis, requesting refill, we will give it to you. But the one that is in trouble is the patient who has what? Hemorrhage, bleeding, lochia, rubra. That's potentially postpartum hemorrhage. Which client should the nurse see first? Same thing, prioritization. There's 7 prioritization. I want you to, they are warm up. You got to do them every day so that you can get comfortable. That is how you master prioritization. Every day, I want you to do at least 10 prioritization to master them. The client report what? Painful urination for the past 3 days. You are in a urology clinic. A client who developed rash after cystogram earlier today. A client scheduled for prostate biopsy later this afternoon. A client returning for a 1-week follow-up visit after TERP. Who would you see? That is transurethral resection of the prostate. Who would you see for urology client in your clinic? Who do you want to see? Which answer choice you would pick? Like I said, this 85 question is challenging. It's a special one for 2026. If you score higher, you're ready to pass the NCLEX. Pick one. Who do you want to see? I know you picked the right answer. Let's break down the keywords, and I can tell you which one are traps, which are not. Well, painful urination for 3 days. Well, it's not fun, right? You may have some UTI or probably kidney stone, whatever. You develop rash after cystogram. Do you expect that? I said what? Be sharp, not expected. If I do a cystogram, should you have rash? That's all. You're about to get prostate biopsy. What is so worrisome about this? And you following up after TERP, right? It's a procedure. I'm not saying you're bleeding. There's nothing there. As you can see, B is the right answer. Why? The answer choice is hidden. This is what you see. Some NCLEX will ask you this kind of question to test your critical thinking. Cystogram, you have to know what it is. And if this is your kidney connected to your bladder and come through the urethra, what do? Cystogram, we inject the contrast and you take a picture of the urethra and go to your kidney. So it's a white. Basically, we're giving you contrast to look the whole body of the kidney structure and all the connection. If I give you contrast, what should I worry about? You may be allergic to contrast. Presence of a rash is bad. That's why this is a priority. Painful urination is a trap. Okay, just because you have pain doesn't mean I have to see you. My B sharp, I said, pain that will kill you, you lose your life and your limb. Life, limb, eyesight. I don't see life, limb, eyesight in the painful urination. You're not going to die from peeing. And 3 and 4 are all routine follow-up. Therefore, what do you see? That one. Which client should the nurse assess first? A client with a sore throat and a white patch on the tonsil. Where are we? 4 clients with reported sore throat. All of them are sore throat, are waiting to be seen in the urgent care. Which client should the nurse assess first? All of them have sore throat. They want to be seen. Who do you see first in the urgent care? One who have sore throat, he has white patches on the tonsil. Another one sore throat with the low-grade fever of 2. Sore throat, muffled voice, and drooling. Sore throat, painful swallowing with what? Trismus. If you are in this situation, which one will you pick? Like I said, be sharp, not expected. If you see expected finding, ignore it. If you see something worrisome, pick it. That's all. That's how you do prioritization. Don't overguess. That's all. If you overguess and you ask so many questions, there's a problem. Pick an answer. And then stop the video. You can put it down in the comment and explain yourself. But like I say, use this like a mock exams and pick one and move on. But be sharp. Oh, I've sore throat. So what? White patches on your tonsil, low-grade fever, muffled voice and drooling, and trismus. I can tell you the right answer is 3. C. Why? Muffled voice and drooling indicate airway. This may be epiglottitis. We don't know. But the presence of muffled voice and drooling indicates that there's an airway issue. Why the other ones are wrong? Look at D. It's a trap, NCLEX trap, and the key content to take with you. Somebody with the sore throat, painful swallowing, and trismus, that means you cannot open your mouth. Versus you drooling, basically you can't protect your airway. That is what? Tonsillar abscess. So this is a tonsillar abscess. This is epiglottitis. Low-grade fever, sore throat. It can be anything. And this one, white patches on the tonsil. You have tonsil infection. Therefore, which one we see is drooling, is the most dangerous patient. And that's why we got to pick it. The rest, we have time. And D is what? It's a trap. And the takeaway, presence of muffled voice, drooling, possible epiglottitis, and that's the airway issue. Which client should the nurse see first? A nurse is caring for several clients with diabetes. Diabetes is very common in the NCLEX because you can find it everywhere. Multiple people have it. So master diabetes, including pharmacology. So what do we have? We have type 1, type 2 diabetes. A, type 2 diabetes, you present with what? Increased thirst and frequent urination. Is this what you expect in type 2 diabetes? Type 1 diabetes, you have blood glucose level of 58. Is that what you should expect? And look at it, diaphoretic. Does that concern you? Type 2 diabetes, report numbness and tingling of your feet. Should that worry you? Type 2 diabetes, finger sticks of what? 450, too high. But I know you watch Adapting class, so you know the right answer. What do you think? Which one is your answer? Which one you picking? I can tell you the answer for number 5 is what? Is B, because the patient is symptomatic. Type 1 diabetes, your glucose is low and you have symptoms. Which one is the trap? Is D. Both of them have diabetes, but one sugar is 450 and the other one is 58. Treat not the normal, but symptoms. 450 has no symptoms. 58 is hypoglycemia. 450 is hyperglycemia. Okay, which one you decide? I said in my B sharp, hypoglycemia is more dangerous than hyperglycemia. If you need more, check Adapting class. But if you don't want to go that pathway, look at it. 450 with no symptoms, 58 with symptoms. That means hypoglycemic with symptoms. When you have symptoms, it's more dangerous. I'm going to see you. Therefore, don't fall for the D. And C is expected. Peripheral neuropathy, numbness and tingling. I'm not doing anything about it. And type 2 diabetes, increased thirst and urination. Probably your glucose is too high. You may be developing DK. But this patient already have symptoms. So we deal with it. Don't overthink about one and say what is going to happen to them in the few seconds. There was nothing given to you. Don't bring anything to the question. There was nothing in that question. That's the way you should approach the question. Deal with what I've given you and don't add anything anymore. So what are we going to see? That one. A nurse is planning care for the following client. Which client should the nurse see first? 1, CHF who has been vomiting for 2 days. Client who has what? Knee arthropathy and slide out of the chair when attempting to get up. So you try to slide, but I did not say fell. So don't use the word fall down, slide. The client who have what? Left-sided stroke 2 days ago and has what? Aphasia 2 days ago, problem speaking. Client with cardiomyopathy who has what? Excessive non-productive cough. This is cardiology prioritization, trying to test your critical thinking. Prioritization into critical thinking. Don't fall for the big words. Just look at the situation. Once again, the way to do prioritization is what is exactly happening to them. Forget about cardiomyopathy. Forget about the left-sided stroke. Forget about the knee arthroplasty. Forget about CHF. What is happening to the patient? Which answer choice you pick? That's the clue. I'm giving you a clue so that you can pick the right answer and do that. I know you picked the right answer. What is the right answer? 1. How do you answer it? Find what this question is asking you. Who do you see first? Okay, one of them is in trouble. Why I pick 1? CHF. Okay, when I see a CHF patient, I know the fluid, what? Overloaded. Their heart is probably not working already. If you're vomiting for 2 days, there's going to be a fluid shift. You're going to have electrolyte issue. These can cause hypotension. Your heart is already not pumping. You have a problem. If there is electrolyte issue, you're going to have arrhythmia. Bad problem, bad problem, bad problem. Therefore, we're picking that one. Why the other ones are not important or not the priority right now, we'll see them later. Well, arthroplasty, you slide down, I got to check on you. I did not say you are in trouble. You not fall, you hit your head, anything like that. You slide when you attempt to get up your chair. So it may be on the slide on the ground. We don't care about it. There's nothing, this already told us. Left-sided stroke, I don't expect you to talk normally. You have aphasia. I'm not going to pick you. Cardiomyopathy, this is the second one. This is the NCLEX. I want you to write it down. This is NCLEX key and distractor. It's put over there. Cardiomyopathy, yeah, heart problem. If you have what? Excessive what? Non-productive cough, that's a cardiac issue, right? It means you have CHF. That patient may be developing CHF, right? But what is the problem? This guy is already in CHF and he's vomiting, electrolyte abnormality, is in trouble. That one, that's why you have to figure out which one you want to pick. 1 is more dangerous than 4. Therefore, we're going to pick this one. So you have to understand that. And this is the explanation. I want you to look at the explanation again. So this patient is vomiting, fluid shift. You're already at CHF, cardiac output is compromised. Now you have a bunch of combination, electrolyte issue. We are in trouble. If you have non-productive cough, you may indicate fluid overload, but there's nothing in the question that telling you is restless, is having dyspnea, showing signs of CHF, just coughing. Therefore, it's not enough. I'm not worried about you. Last prioritization question. Did you get 7 out of 7? After this, I know you do. Which client should the nurse see first? It's a child. The pediatric nurse is caring for what? 4 children, 4 peds. Who is in trouble? 1 child with a Worms tumor who has abdominal distension. A child with acute lymphoblastic leukemia who has a fever of 101.8. A child with cystic fibrosis who has productive cough and a temperature of 101.8. A child with hemophilia who has bruising on the same arms and legs. What do you think? Once again, forget about the big words, the diagnosis, focus on the problem that is happening to them. You can have ALN, but if there's nothing happening to you, I don't care. If you have cystic fibrosis, I don't care what is going on. Which answer choice you pick? B is the right answer. Why? ALL, leukemia, low-grade fever, sepsis, neutropenic precaution. I got to worry about it. Otherwise, you're going to get into trouble. Worms tumor, you're going to have abdominal distension from the tumor. It's a small tumor in the kidney for young kid, right? It's similar to pheochromocytoma in adults. Well, you're going to have abdominal distension. It's expected. Cystic fibrosis, you have recurrent lung infection. So you always have fever. But remember, B and C, they all have fever. But whose fever is the worst of all? That's what prioritization is. We both have fever. One has productive cough and a temperature of 101.8. But leukemia patient fever is more dangerous because they can develop sepsis easily compared to cystic fibrosis, which may be due to recurrent lung infection. Hemophilia, well, you bleed all the time. So you may have bruises on your extremities. There's nothing telling me you're bleeding into the joint. When I see bleeding into the joint, yeah, I'm worried about it. This is just bruising on your arms and leg. That's not a problem. 7 prioritization question. How did you do? 85 questions. These are designed to help you pass the NCLEX. Especially for 2026. I intentionally put these questions together. If they are hard, I want you to use it like a mock and then take your score. Keep track of it. Go read more about it. If you need help, Adapt NCLEX got your back to help you pass the NCLEX. But these questions, pay attention. Don't memorize it. I just want you to know how to approach the question. It's the same contents. They can use it any way they want. But if you know how to approach it, it does not matter what they give you. You can walk your way through it. So let's go. Number 8, delegation. Well, I don't know what kind of strategy you have, but please, I want you to take this. This is Adapt NCLEX strategy. It's easy. Don't memorize a long sheet of paper telling you about what you need somebody can do. All I say to you is this. If you have time, write it down. The RN is going to do everything, right? Including the most important evaluation, assessment, and teaching, first of everything. If they don't want to do it, they can delegate. How? They give it to the RPN. And what is that? MMR most. You can check my delegation videos. What is that? Anything they can monitor. It doesn't matter what it is, they can monitor. They can reinforce any teaching you provided because they cannot teach the patient. They can administer most medication except high. So most medication include a bunch. It's only few of them. They can provide ostomy care. That's the O. And again, they can give 2 feed. They can do some special tests. That's all. And I said the UAP, well, only ADL, anything that does not require thinking. That's all. I don't want you to memorize a list of bunch of stuff that you should have to put in. These are all you need. And every question, look for the adjective. That's all. I've given you the secret for delegation and assignment. Which client tax is most appropriate to delegate to the UAP? And nurse is making assignment for the evening nursing team. Fine. Who? UAP. Anything that does not require thinking. And what? ADL. A client who need what? Steroid dressing change 2 days after surgery. Do you think it's appropriate? Left-sided stroke. Perineal care. Client has suprapubic catheter care. We need to provide care for suprapubic catheter. Patient had heart failure who need initial vitals. That's all. Heart failure, initial vitals. You have suprapubic catheter, I need to care for it. Left-sided stroke, I need to provide perineal care. And I need steroid dressing change after 2 days of surgery. What did I say? ADL. If you see ADL there, then pick it. And otherwise, anything else is a trap. The only thing I see is perineal care. That's ADL. It's different from suprapubic catheter. That's catheter care. That's special. You need some sterility. You need other things. UAP, stay away from it. Steroid dressing, stay away from it. Initial of everything, stay away from it. Therefore, P is your right answer. Which tax is most appropriate for the LPN, MMR most? That's all. RN, LPN, UAP are caring for a client with DVT, deviant thrombosis. Everybody staying in their lane. When all three are there, UAP does what he does. RN will do what she can do, and LPN. Nobody cross over, even though RN can take vitals, or the LPN can take vitals. When three is there, when there's specific vitals, UAP can do that. Therefore, this question is for LPN. Assess the client for signs of bleeding. I said MMR most. The word assess was not part of it. Initiate the plan of care. There was nothing like that. Instruct, teaching the client on correct application of compression device. No teaching. Reinforce teaching, but no teaching. Measure the client for correct fitting of the graduate. You see, he has nothing about eating, evaluation, assessment, and teaching. He's just measuring. They can measure, they can put it on, but for the teaching of that graduated compression device, initial one has to be provided by the RN, and then the LPN can reinforce. So measure it and feed them. Which client is most appropriate for the LPN to care? Same strategy. Don't make it difficult. And nurses assigning client to the LPN. A client with infective endocarditis, you want to give them somebody who is stable, predictable outcome. That's all. Infective endocarditis, safe for LPN. Client with air embolism, safe for LPN. Client in skin traction. Client experiencing acute psychosis. Delegation 101, adapt and close way. Which one? You pick your answer choice. If you are the RN, which one will you give it to LPN? You know, traction, enjoying, patients not moving. Of course, there's certain things you have to do. But among all, infective endocarditis, your heart, you worry about emboli, stroke, and everything. Too much problem. Air embolism, never, because that patient is about to die very shortly. And psychosis, oh, it's going to chew the LPN up. You need experience, what? RN, therefore, traction, stable patient. Which client should be assigned to the RN? Now, the RN, the boss, has to take over. So now that you understand, like I told you this, I said the question to walk you through step critical thinking. You can see what I'm trying to do with your mind to get you into a shape where you'll be more confident when you're taking the NCLEX. It's like you're watching Adapt NCLEX video. Which client should be assigned to the RN? A nurse is working with the RN, LPN, UAP. Now, what would the RN see? Somebody is sick and dying. Client who require routine stomach care. What? Client who need a blood glucose check. What? A client with T6 fracture who report a severe headache. What? A client with fever, headache, and crying. What? Which one you think is dangerous? If you make a diagnosis for each of them, you know who is dying, who is serious, and who need to be seen. Pause the video, few seconds, pick your answer, think about it, put it in the comment, say, number 11, I got it. What was your answer? You know that this is your right answer. Why? T6 fracture or report severe headache is what? Autonomic what? What do you think? This reflexia. This is a problem. It's a spinal cord injury, and they have a problem. They have ICP issue. You need to get them ICP down as much as possible. Elevate them up. Make sure you find what is stimulating them and take care of them. But if you need a stomach care, LPN can take care of it. Need a blood glucose, UAP can take care of it. Fever, headache, and crying, LPN, it's all yours. Take care of this patient. 12. I move to another stage. What is that? Infectious control. We are now infectious control. These questions are a little bit tricky, but I got you. I want you to take a pen and paper and write some of the key. They are not some of the infectious control we've done. This one is really test-taking strategy. Which statement by the parent indicate a correct understanding of the teaching about what? A nurse has taught a group of parents about what? Varicella infection. My child can return to school once the fever is gone. Is that true if you have varicella? The rash usually starts on the trunk and spread outward. Consistent with the disease? Antibiotics are used to treat the virus. Is that true? Once the blisters appear, my child is no longer contagious. What do you think? Stop the video. Put down your answer. This is a concept on what? Varicella. Write it down. What is the concept? What is the concept to use to answer the question? Did you pick an answer? I know you did. How do you answer this question? What exactly is the question asking you? Correct understanding about what? Varicella. I'm taking those two information and picking it together. I know this is what? Airborne. What do you need to know? The most important concept to answer the question, that rash, you don't go anywhere until it's crushed it. And it takes about 7 days. You're usually infectious 3 days before. So a total of 10 days isolation. You cannot return once your fever is gone. It's not about the fever. We're talking about rash. The rash, of course, starts from the trunk and spread down. Correct answer. Antibiotics are used to treat the virus. Ankle strap. Write it down. Ankle strap. You see infection, you forget that this is varicella. This is what? Virus. You can use an antibiotic for a viral problem. Negative. Once the blisters appear, my child is no longer contagious. Now, another 7 days of contagiousness. Therefore, I know there's no word for contagiousness, but the baby is going to be in isolation for another 7 days. Therefore, the rash spreads usually start on the trunk and spread outward. First, infectious control. Second one, this one, if you don't know it, I want you to try it, but it's okay if you get it wrong. But that is the concept, the purpose of this question, so that you write it down, because it's easy for the NCLEX to trap you. Classic NCLEX test taking strategy. Select or apply. You don't have to select all. If you know only one, just pick one. Which personal protective equipment should the nurse don when providing care for what? The client. The nurse is caring for a client with what? Bacteria, meningitis, will require what? Suctioning. That's the buzzword. Pay attention to that. Gown, gloves, surgical mask, N95, face shield, or goggles. What do you think? Which one would you pick? If you know only one, just pick it. I know you watch Adapt and Class, so you get the right answer. So pick all the answers so that you can get all the points. Did you pick yours? Let's break down the question. And I'll show you why, which one are the right answers. What exactly is the question asking? If you do that, that's 50% of the answer choice. Now, what is asking is what? Requires suctioning, bacterial meningitis, and PPE. Combine them together. I have meningitis. I'm going to do suction. I need a PPE. Those are my buzzwords. And I said, hey, meningitis, what do I need? It's a droplet precaution. Okay. Suction, what do I need? Protect my face. There's aerosol going to my face. I got to protect my face and my body. Therefore, what do you think we have? Bacterial meningitis, even though it's droplet, when you're providing suction, you got to do what? Contact precaution in addition. What do you need for droplet? I need what? A surgical mask. What do you need? What? Contact? I need a gown and the gloves. Do I need N95 respirator? No. Do I need to do face shield and goggle? Ask yourself. Ask yourself. Yes, because it's in your face. It's spread into your face when you're suctioning the patient. Therefore, which answer choice do you think we should pick? Gown and gloves and face shield are for the contact portion of it, and the surgical masks are for the droplet. That word alone, the keyword, the takeaway, write it down, is what? Suctioning. Don't only focus on bacterial meningitis. I keep on saying buzzword. I'm not joking, guys, because that word alone changes the content of the question. I can remove suctioning and the answer choice changes. So you see this question somewhere, you memorize the answer and you pick it. But then NCLEX put suctioning there. Now is a new question. You put the same answer choice there, wrong answer. So pay attention to the buzzword. And that's what I explained here. Bacterial meningitis require droplet precaution, or suctioning, there is a splash and a spread. Therefore, it generates procedure that will need contact precaution. Right here. This is another one. Same strategy. A client has MRSA in the lung. Which transmission-based precaution should the nurse implement? Don't jump the gun. There's the reason why I put the MRSA in the lung. You've seen questions on the skin. Well, prepare for the NCLEX to put it in the lung. Do you think you should change your strategy? Ask yourself. Select or apply. What transmission-based precaution should the nurse implement? Wear gown and gloves during client care. Institute droplet and contact precaution. Institute contact precaution, use of soap and water for hand hygiene before and after client care, wear gown, gloves, and surgical masks for routine care. What would you do? Which one would you select? Trust me, I'm trying to help you to so you can master this infectious control. Stop the video, pick your answer. Let me know what you think. I want you to get this right. If you get it wrong, it's okay, but write down the concept down. Number 14. What did you pick? I can tell you the right answer is what? A. The next one is C. And the next one is D. What do you see between them? Let's break down the question. I already break it down halfway already. MRSA, what is that? And the lung and transmission base. So these are the things we're talking about. MRSA is a contact precaution, right? It's a contact precaution. Whether it's in your lung or on your skin, it's still what? Contact. It becomes droplet if the patient is coughing or you're trying to like suction the patient, right? But right now, what is the patient? Patient has MRSA in the lung. Unless you touch the patient or you touch any of the droplet from them, it's still contact. It never changes. Therefore, you wear gown and gloves during routine care. That is contact precaution. You don't institute droplet, but you institute contact precaution. So this is partially right. So wrong answer. You institute contact precaution because it's what? MRSA. What do you do for MRSA? You got to wash your hands, not hand sanitizer. You wear gown, you wear gloves, but you don't wear surgical mask. It's a trap. This is the NCLEX trap. This is for droplet. You're considering because it's in the lung, it's now a droplet. No, it's still a contact. Therefore, 1, C, A, C, and D are the right answer. I want you to come back to this question. When you see it, just know that MRSA is contact no matter what. And this is reviewing transmission-based precaution for several clients. Which of the following statements are accurate? Select or apply. That means, what are we doing the right thing for these patients? A client with MRSA in the lung. This is to reinforce what I've taught you. That you see it again. Required droplet. Is that what I said? Client with what? Active tuberculosis require airborne precaution. Clients with what? Bacterial meningitis require contact precaution. Client with varicella, chickenpox with crusted lesions require airborne precaution. A client with Lyme disease require droplet precaution. How much do you know about your transmission-based precaution? This is testing your knowledge. Stop the video, pick your answer, as usual, in the comment section if you want. And then let's think about what we have. 15, number 15. What do you think? You pick your answer? It's a select or apply. You don't have to pick everything. Select or apply, pick those that you're 100% confident. But what is the question asks you? Transmission-based precaution about a bunch of people. Find the name of the organism and see if it's appropriate. Is it the normal appropriate transmission-based precaution? MRSA in the lung, I told you it's a contact. It's not droplet. Wrong answer. Active TB is what? Airborne. I see airborne there. I'm going to pick you, right? That one, straightforward. Bacterial meningitis is the droplet. I see contact. I'll let it go. Varicella is airborne and contact. But if you have crossed the lesion, you are what? Standard precaution. You are no more airborne. That's NCLEX trap. Once again, NCLEX trap. Write down that one down. That's the concept. This is what NCLEX want you to take. Varicella that is crusted, that means there's no more contagious. They are not infectious. Therefore, you don't need airborne anymore. Lyme disease, unless you get bitten by a tick, come on, it's a standard precaution. Therefore, it's gone. One answer alone. If you pick more than one, you get 0. Why do I do that? Just to teach you so that you be confident. When you see select or apply, you don't have to pick everything. You know that whichever you're confident about, you pick it. One answer alone. Those are the answers. I explain it for you. These are Dr. NCLEX Q Bank. I make questions up and I try to track you, but these are high yield concepts. These are questions you never see anywhere. They may look similar to things you've seen because the content are the same, but I can trick the question in a certain way to let you think critically so that you see those easy questions and say, oh, I know how to answer that. You ready for this? Next generation NCLEX case study, NGN. After 15 questions, I want you to relax, step back. You said, I got to go through 5, 6 questions in one. But I made this question based on recommendation. It's a psych what? Case study. Most people get afraid. They run away from them. Don't. This is a defense mechanism question. And I design it so that you can know how they can test you on this. You know the content. Don't be afraid. So when you see a psych case study, just bring your content. What do? How do you read it? Start reading it from the first 2 sentences and figure out if you know what is going on. 28-year-old female, okay? Admitted to the psych unit, okay? Crisis at work, something happened at work. There's a trigger here. She report, no one likes me. That's a complaint. That's a chief complaint. Bring this to the psych environment now. If somebody said no one likes you, some diagnosis should pop out in your head right now. And as a history of conflict with co-workers and family, always fighting with people. She's tearful. She said nobody like her, but she's tearful, expresses intense anger. Ooh, and difficulty trusting anybody. You see what is going on? She doesn't not trust anybody. She expresses anger. Those are all buzzwords. You got to circle it because you need it to answer the question. Does that give you a clue? Nobody like me, always fighting with everybody. She doesn't trust anybody. And she states, if you leave me, I will never forgive you. That's your diagnosis. Who will say that? She don't trust anybody, but she said, if you leave me, you the nurse, I will never forgive you. She wants you to be around. What kind of diagnosis is that? I told you. Personality disorder or whatever it is, you can figure out yourself. Temperature, vitals, everything is normal. Past medical history, he has no medical history. No history of self-harm, very important, not suicidal, but he has attempted to manipulate situation to get attention in previous admission. Do you see it? That's your clue. You see, don't let them go. But patient has not committed suicide, but can manipulate situation to get attention in previous admission. When you read the question, you finish, get some clue. Figure out what is going on with the patient. And you know that this patient, you can see, right? There's something going on. Is he obsessive compulsive? Do you think so? Is it washing his hand? Is it dependent personality disorder? Is depending on people? Dependent people, do you think they manipulate people? Is this patient a borderline personality disorder? It has not committed suicide, but can manipulate people and get their way, and they want you to be around. They split from one place to another. Figure it out. I know you got it. And you can answer the rest of the question, right? The nurse has reviewed the clinical data. Which initial assessment should the nurse prioritize? Assess for suicide, ask about sleep pattern, assess nutritional intake, determine social support network. When psych people come in, physiological need take over psychological need. Anything about psychological, ignore it. Social support, psychological. Nutritional, hey, it's important. It's physiological. About sleep, also, right? But suicide, you can see which one will you prioritize. That one. Suicide is more dangerous than seeing if they want to eat anything in this situation. Very, very important in that situation. So we'll pick that one. The patient said, client state, if you leave me, I will never forgive you. What is the best therapeutic response? What would you say? You then say what? You will forgive me. Don't worry. Is that therapeutic? I'm staying here to help you right now. Is that good? That is not true. I'm not going anywhere. You are reassuring the client. Everyone feels that way sometimes. Well, I'm not everyone. I'm a patient. I said, if you leave me, I will never forgive you. Which one is the right answer? I'm here with you to help you. It's generalized, supportive to the patient. It's not argumentative. I'm here to not reframing what she said. You don't know whether you will live or not, but he said, I'm here to help you. Reassurance is much better. Which behavior are most consistent with borderline personality disorder? What do you think? Intense anger, fear of abandonment, and impulsivity. Is that borderline? Detached, right? Indifferent, what? Avoid social interaction. You can see those are accessory group, right? Grandiosity, elevate themselves, thought. Need for admiration. Sound like what? Narcissistic to me, right? Exploit others, right? I don't think that's antisocial, right? Obsess attention to what? Details, perfectionism, inflexible rule, obsessive compulsive. This is how they can ask you about personality disorder. Don't make it difficult. You know it. You can see that patient is the one who look like borderline personality. Intense anger, fear of abandonment, and impulsivity to that one. Which intervention is most appropriate when caring for a client with borderline personality? Now, you know they can trick you. They can manipulate the situation. So what do? That's the concept. Take their medical problem and flip it. If they can manipulate you, you should take ahead, right? Encourage peer confrontation to correct behavior. Is that good? Set clear, consistent boundaries and limits. Is that good? Avoid discussing emotions to prevent escalation, right? Allow the client to dictate all care. Of course, they're not going to dictate all care. You're not going to avoid. You got to attack them according to the situation. Otherwise, they will maybe manipulate you. Attacking means you're not going to beat them up or anything like that. What they're going to do to you, flip it on themselves. You should encourage what? Confrontation to correct behavior. No. Set clear rules. This is the way we're going to do it so that the patient does not manipulate you. Which statement by the nurse promote healthy coping for the client? Now, every psych condition, you got to learn how to diagnose it and then help them cope. When they're coping, they are adjusting. When they're coping, they know what is going on. When they're coping, they've accepted the situation, following therapy. Therefore, any negativity is not coping. That's the way you should see these kind of questions. So that's the way I want you to see it. You should ignore your feelings until they go away. Is that good? Try journaling your emotion and use deep breathing exercise when upset. Oh, that your anger situation, you can deal with it. Confront others when you feel angry. That's not what we want to do. You can see test-taking strategy. B and C are talking different against each other. One of them are right answer. Rely on others to make you feel better. Well, that's why she said, if you go, I will never forgive you. No, you should not. Right? Therefore, journaling is the best answer. And the last one, which outcome is the most appropriate for the client with borderline personality disorder? They're able to take care of themselves. They have coped to the situation. So pick an answer choice that is like that. Mental health case study are a little bit tricky, but don't worry. The words may sound good. Just bring the concept. I just give you the concept. So look at the answer choice and see if you fit. The client will eliminate all conflict with others. No, that's not possible. They're going to fight once in a while. The client will stop all impulsive behavior immediately. There is no way. The client will depend entirely on staff. There is no way. The client will recognize the triggers and use coping skills to manage emotional. This is adapting class. How did you do? Mental health case study can be like that. There's no calculation, there's nothing, but there's a concept. Stick with the concept and go through it. I'm going to take you through cardiology. You ready? If you're tired, take a break. We finish with prioritization, delegation, infectious control, and we did a case study. If you want to take a break, but come back and let's finish these 85 questions because they are most tested, must know, designed for first-time, repeat test takers, nursing students, so that you can be confident when you take the NCLEX. Let's get to it. Cardiology, high yield. And nurse is monitoring a client with what heart failure who is receiving Hypothyroidism therapy. What do you think? Which of the following findings require immediate notification of the healthcare provider? That means bad stuff is happening. Dizziness when transition from sitting to standing position, headache, leg cramps, and tendinitis. What do you think? Which one would you do something about it? You need immediate notification right away. First, you got to recognize the medication. What is the medication? Which answer choice you pick? Lock in your answer in a few seconds. You lock in? Now let me show you what the question is asking. First, what exactly is the question is asking? Go for the buzzword. Receiving Hypothyroidism therapy. This is a loop diuretic. If you don't know, it looks like a Furosemide. So you know it does the same thing as Furosemide. Require immediate notification. That means these are bad. All of them are not good. Dizziness is not good. Headache is not good. Leg cramp, never good. Tendinitis, never good. But which one? You got to do something right now. Otherwise, you're going to cause damage to the patient. Where you can tell them to transition from one place to another slowly. Headache may be dehydration. Leg cramp may be early sign of what? Potassium. But this, if you don't do anything right away, hearing damage. So orthotosity associated with that is very dangerous. Somebody will pick C, but it's a trap. There's time. I've not told you there's EKG changes from the question. There's nothing. This is all you're going to get if you're going to have hearing damage. If it's due to potassium, you may see EKG changes. So I may give you a clue in the question. Don't make it up. I never give you a clue. So I'll pick somebody. The only sign I'm going to see for ear damage is that. So that's why I got to do something right away. And later on, we can do that. Which statement indicate need for further teaching by the nurse? Cardiology. A client being discharged home with Digoxin for heart failure. Cardiology. NCLEX love cardiology, Digoxin. I will inform my healthcare provider if I develop nausea and diarrhea. Is that expected? I will increase my potassium intake. Is diet through teaching? I will need dry level check frequently. Is that appropriate? I will check my apical pulse 1 full minute before each med. Digoxin, whether you like it or not, is coming. How do you do that? Master the content. You pick your answer choice. I know you did. And I know you did not pick this because it's an expected finding. Further teaching does not require further teaching. Level is going to be checked because it's a dangerous medication. Does not require further teaching. When you are on digoxin, don't increase your potassium, don't decrease it. Consistent amount, bad problem. If you develop nausea, toxicity, let me know. Therefore, which one needs further teaching? B. Which of the following age-appropriate activities is most appropriate for this child? And nurse is caring for a school-age child diagnosed with what? Heart failure. Which of the following age-appropriate activities is most appropriate for this child? Competitive soccer, video games or board games, jump rope with friends, relay races in gym class. Which one is appropriate for a school-age child with the heart failure? Let me guide you for the buzzword, and I know that will help you pick your answer choice. It's a school age. Okay, is this appropriate? Number one. But the number two buzzword is for CHF. What do you think a CHF patient should do? Quiet environment, low impact exercise. Which of these will you let them do? That's all. This is what I call buzzword. I rewrote the sentence, the question, the stem of questions using only two, school age and heart failure, and I know I should never put them in a stressful situation. Competitive sports, negative. Video game, oh, you can stay in the basement all day and do it. Jump rope, too much energy. Racing, too much energy. Therefore, which one you think? B is the right answer. How do you get it? By breaking down the question. And I know you got it. Thank you for watching. Question 20. Thank you for staying around if you stay here. And thank you for watching this adapting class. I make videos for nurses, nursing school students, those taking their NCLEX. I want you to pass your test. Okay, that's why I make these 85 so that you can test taking strategy. You can master them. Nobody can take away from you. So use them. And this is assessing a client prescribed methylprednisolone for what? Coronary disease. Which of the following findings are modifier, cardiovascular risk factors? I underline the buzzword for you. I decided to underline because I think it's a key point. But it's a selected apply. You don't have to pick all. Blood pressure 150/90, total cholesterol of 280, family history of myocardial infarct, BMI of 32, and carrying smoker. Which one is a modifier cardiovascular risk factor? You pick your answer choice, select or apply. Don't over-select, and don't be greedy. But if you know it, pick them. But if you don't know it, then just be selective, those that you're 100% sure. If you know 5 and you're 100% sure, I want you to pick it. But if you know 3 and you are like the fourth one, 50-50, leave it alone. And you keep your 3 points rather than losing 1 and get 2 points. Therefore, keyword is this, modifiable. I can change it. This may be all cardiovascular risk factors, but something I can do something about it. That's all. If you can do something about it, your blood pressure, you can help with your blood pressure, right? Your cholesterol, you can help with your cholesterol. Your family, you can change where your family from. Your family already giving you the gene. Good luck with that. BMI, you can change that. And smoking, well, you can decide not to smoke. Those are your right answer. That's the definition of modifiable. And nurse is caring for a client who is 1 day post-endovascular abdominal aortic aneurysm repair, which finding are concerning and require immediate intervention. Selected apply. Decreased pulses in the right foot, cold pale extremities, urine output 20 ml per hour, periumbilical ecchymosis, blood pressure of 90/60. What do you think? Pause the video, selected apply, pick those that you're 100% confident. Go for the buzzword, the concept associated with it, and then pick your answer choice. What is your answer? Did you pick one? I know you select the right answer. Then let me show you, break down the question for you. Endovascular repair of aneurysm. That means if this is the aneurysm here, endovascular, there's no incision. We go through your groin and fix the aneurysm. After surgery, we got to check your vascular exams. If its pulses are decreased, it's a bad problem. I don't care what it is. It's a pulse that is decreased because I went to the artery. If you have cold pay extremities, that's shock, bleeding. Urine output 20, that is bleeding. Your kidney is not getting blood. Periumbilical ecchymosis, bleeding, right? That's Kellen sign. Blood pressure 90/60, that is bleeding. What am I trying to teach you? After endovascular repair of abdominal aortic aneurysm repair, the priority is look for bleeding. And what are the signs of bleeding? Decreased pulse, extremities cold, urine output getting low because the kidney is not getting anything. You have periumbilical ecchymosis, your blood pressure is low, you are anxious, you're tachycardic, you're sweaty, all of them. You have shortness of breath, your respiratory rate is going up, all of them indicate shock. And those are our shock. Therefore, this patient, all of them, need intervention. This is a teaching question to teach you hypoperfusion. This is my favorite question. Kawasaki, I love it. It's called T-Crims. And Chris love it because it's a cardiology question. Which finding is most concerning? And this is caring for a child with Kawasaki disease. Fever 101.5. Severe strawberry tongue and sore mouth. Vomiting and tachypnea and skin peeling. When they ask you Kawasaki question, always come back to adapting class and watch their video. If you do a question, you get it wrong, I want you to come back to this. T-Cream. Always write it. That means all these conditions is expected. T-Cream. Temperature over 5 days. Conjunctivitis. Rash. Erythema rash. Adenopathy. And they're going to have mucositis. Anything else is the priority. Fever, right there. Ignore it. Strawberry tongue. Mucositis. Vomiting. I don't expect them to be vomiting, having tachypnea. Skin peeling, that's the rash. Why are they vomiting? Because there's a cardiac effect now. Kawasaki patient who has tachypnea and then vomiting is in cardiomyopathy, is having heart problem. That's a priority. We should worry about it. Remember, they're going to develop aneurysm and dissection, and therefore this patient finding, even though you never pick vomiting as an answer choice, in this situation, that is it. Therefore, vomiting and tachypnea may indicate cardiac involvement or early heart failure, which is more concerning than all those fevers. Which instructions should the nurse include to help a client prevent damping syndrome after gastric surgery? Did you notice what we done? We finished cardiology, now we're from GI. How much do you know about GI? GI is my favorite because the concept there are straightforward. Now, which one would you do to prevent damping syndrome? Write it down. Damping syndrome is NCLEX favorite. They love it. If you know it, you have one question knocked down. If they give you that question, remember it's an adaptive. Eat small, frequent meal. Lay down after meal. Drink fluid with meal. Increase intake of simple sugar. Consume high protein, moderate fat diet. What do you think? What is your answer? Pick one. Damping syndrome. The way to answer the question, go with the concept. What is damping syndrome? I don't want fluid to just go down inside you right away when you eat, because this is what their stomach used to be. Now they have this tiny stomach, right? So when you eat, boom, it's going down. Therefore, how do you prevent food from going down? Well, it's easy. Small frequent meal. You should lay down after you eat so that the food doesn't go down here. If you drink fluid with the food, it's going to push it down. If you eat a lot of sugar, simple sugar, you should eat complex sugar, not simple. And then protein, that one is good. It has less sugar in it, and therefore that is better. So what you tell them is protein shake, moderate fat diet, high complex sugar, and don't drink with food, lay down, and then eat small frequent meal. Therefore, what do you think is the right answer? Consume that. That's number one. Eat small, lay down. But don't drink fluid with it. That's unacceptable. And then increase simple sugar. And that's the concept. You can take a picture of it. And this is assessing the client with acute appendicitis, right? Which assessment finding are expected in the client with appendicitis? Select or apply. I want you to try this, pause the video, pick the answer. If you get less, you don't get all the answer right, it's good. Then you've learned something, because this is a classic question you may see. People get confused about expected finding about appendicitis. I'm giving you all of them in this particular question. So pick your answer choice. Let me know. You can put it in the comment, explain why, and then send me an email if you want me to explain it better. So appendicitis, this is your belly button. It's on the right side. So this is where, two-thirds, McBurney's point. That's where you're going to have pain. So you have periumbilical pain migrating to your right lower quadrant. This is appropriate. That's number one. Relief of your pain when you move. When you have appendicitis, when you move, you have more pain. This is a trap, NCLEX trap. High fever. This is another trap. You're going to have fever, but it's not going to be high. Usually 101.1, 101.5. High fever is like 103, 104, 102. That means there's perforation. You have abscess. It's not acute appendicitis anymore. Palpable mass on the right lower quadrant. I told you you're going to have right lower quadrant pain. But if you have a mass there, I can feel it. It means you have abscess. It's not, or you have a phlegma, big mass there. It's not acute appendicitis anymore. This may be more than that. It's unexpected finding. A Murphy sign is usually when you push on the right upper quadrant. That's associated with the gallbladder. So you see, what do you see? The one's a choice there. The rest are all trap. Don't fall for them. Once again, don't fall for them. Only one answer. Which of the following findings should the nurse suspect? Select or apply. A nurse is caring for a client with what? Acute pancreatitis. What do you see? Tearing chest pain radiating towards the back. Elevated serum amylase and lipase. Abdominal distension and tenderness. Nausea and vomiting. Which of these would you see in acute pancreatitis? This is GI pathology. This should be straightforward, but there is trap answers designed to make you stay focused. Which one do you pick? Which one were your answer choice? Let me know. You select your answer, so select or apply. Don't over-select. Therefore, what do you see? Pancreatitis is in your abdomen. And I see chest. Tearing chest pain is thoracic aortic aneurysm dissection. Boom, wrong answer. Just because I put radiating towards your back, this is a tearing chest pain. It doesn't know. It's epigastric pain radiating towards the back. Your amylase and lipase is going to go up. That's an expected finding. You're going to have abdominal distension and tenderness. Expected finding. Pain relieved by laying supine. No, the pain is relieved by in the fetal position. When you lay supine, it's going to hurt more. And then you may have nausea and vomiting. So those are the right answer, which was nausea and vomiting, abdominal distension, amylase and lipase elevated. The rest unexpected in the presence of acute pancreatitis. And this is assessing a client with ulcerative colitis, which statement indicate a lack of coping. Once again, we saw coping in the side questions on the case study. Coping means you're not following treatment, they're arguing, basically making excuses. I feel like I can manage my diet and medication just fine. What do you think? Does that sound like I'm coping? What do you think? I'm afraid to leave the house because I might have an accident. Is that patient coping? I get frustrated and cry when I have diarrhea. You have ulcerative colitis. What do you think? I try to plan my day around my symptoms. I don't eat any food that causes a lot of gas. Which one does not indicate it does not indicate coping? Remember, the question said lack of coping. So indicate a lack of coping. That means they are not coping the way they're supposed to. He said he can manage his symptoms fine. It's good. Does not want to leave the house. You're not coping. Get frustrated when you have diarrhea. You are not coping. He said, try to manage and plan around his symptoms so that when he's at home, he can have symptoms. Otherwise, when he's going out, there's no symptoms. He plan around. Does that tell you that something? What do you think? Does that give you a clue? I don't eat any food that causes a lot of gas. That's good one, right? So these are little bit things that you should figure out. You can see it does not want to eat anything that causes gas. I try to plan my day around my symptoms so that I can figure out what is going on. And I get what? Frustrated and cry all of the time. So therefore, whenever I have diarrhea, these two, she's not coping. That's a problem. And next, I attended the staff education program of what? Gastrointestinal diet. Which of the following matches pair by the nurse demonstrated correct understanding of the teaching? That means trying to figure out if she understands what is a clear liquid, what is a full liquid, what is a mechanical soft, what is a regular diet. A clear liquid diet, you can see through. Full liquid, you cannot see through. Mechanical soft, you don't have to chew. Regular, you chew it. What do you think? What is your pairing? Let me know. Which one did you pick? Clear liquid diet, popsicle. When it melts, it's clear. Coffee is good for clear liquid, but if there's a milk, it becomes full liquid. Scrambled egg is a soft, and then regular diet is peanut butter. So this is the pairing that you should expect. You can take a picture of it. And next, provide care for a client with new diagnosis of Crohn's disease. Now, endocrine nursing, endocrine NCLEX review. We are in endocrine right now. Get your stuff together, get something to eat or drink, and come back because this is my favorite, endocrine. Most of the time, select or apply. And you got to be confident because they will see with risk reduction questions associated with that. Patient has Crohn's disease. Which finding the nurse should expect? What? Hypokalemia, hyponatremia, hypotension, headache, metabolic alkalosis. What you need to know, figure out what is Crohn's disease. If you know what is Crohn's disease, you can see that you can figure out a question easily. So I will repeat it again. Stop the video, select your answer because this is a mock exam. Pick yours and then let me know. Then you can listen to me. Crohn's disease, all you're doing is aldosterone, too much aldosterone. And what does aldosterone does? Hold on to what? Sodium. If your sodium is high, water. If both of them are high, hypertension. If sodium is high, your potassium go down. Therefore, hypokalemia. Is that what you expect in a patient with that? Yes. Hyponatremia. No. Sodium is supposed to go up. Hypotension. No. Your blood pressure is supposed to go up. You're going to have headache. Yes. And you're going to have metabolic alkalosis. I got to explain that to you. If this is your cell, and then you lower your potassium, you push all your potassium inside the cell, your body want to get back the potassium. So you push potassium out of the cell, and you got to replace it with acid. So you push acid back inside the cell so that the charges can equilibrate. When you lose acid, you develop metabolic alkalosis. So that's why Hypokalemia due to Crohn's disease can cause metabolic alkalosis. Therefore, this and that. Those are your right answer. And these are some of the signs and symptoms you should expect. And this is provide teaching to a client prescribe levothyroxine for hypothyroidism. Know this, hypothyroidism treatment, especially central, which is what everybody knows. But the actual NCLEX question will say levothyroxine. You got to provide teaching about how to take it because a bunch of people have it and they're going to ask you about it. Which teaching is appropriate, select or apply. Don't over-select. Pick those that you're 100% confident. Take the medication with an empty stomach. Take medication in the morning. Remain upright for 30 minutes after taking the medication. Add omeprazole to the pill to ensure fast absorption. Take the medication with full glass of water. If you see this question anywhere, any Q bank, anywhere, even in NCLEX, this is the exact questions they're going to ask you because this is the content associated with levothyroxine. And there's a concept. What is that? Because it's esophagitis. That's all. Acid prevent it from getting absorbed. Therefore, which one do you select? I know you picked the right answer. Empty stomach, early in the morning. That's how you take it. Take it in the morning, early in the morning, empty stomach. You remain upright so that you don't cause esophagitis, so that the medication goes down quickly. If you add omeprazole, it can affect absorption. It does not improve absorption. You should take a full glass of water to prevent esophagitis. Those are the teaching you provide the patient. A client arriving in the emergency room in Myxedema coma means hypothyroidism in severe condition, which assessment finding by the nurse is most concerning. Respiratory rate of 12, blood pressure of that 57/45, temperature 95, confused and does not follow command. This is my favorite. This is what I use for my crash course. This particular question, as the first question I always asked when we're doing endocrine, because it's my favorite question, right? Which answer choice you pick? A bunch of bad stuff. A bunch of bad stuff. I want to know what you think. Put it in the comment and let me know which one you select. I'm going to guide you. Myxedema coma is the same thing as hypothyroidism, but it's the worst one. That means hypothyroidism, everything is going to go down except your weight. So you're going to get weight gain. Apart from that, every system is down. You see the respiratory rate is down, blood pressure is down, temperature is down, confusion there. But which one is dangerous? Which one is going to kill you right now? You can be confused and you don't follow command, okay? But you're still alive. Your blood pressure, this one, there's no pulse pressure. Patient has no pressure. Hypothermia, bad. You can have cardiac arrhythmia. But this one, it looks like it's in tamponade. Pulse pressure means the difference between systolic and diastolic at least 20. Patient does not have 20. That means it's systolic. There's no blood movement. It's dead. And that's that patient we want to see. When teaching a client diagnosed with diabetes, which point about proper food care should the nurse include? This is another concept. Write it down. Read about it. Food care in a diabetic patient. NCLEX favorite. That's what we teach patients all the time about diabetes. Select or apply. Wash foot daily with mild soap and warm water. Apply lotion between your toes. Inspect feet daily for cut, blisters, and redness. Wear shoes and socks at all times, even inside. Soak feet daily in hot water to relax muscles. What do you think? Diabetic patient. Remember, they may have peripheral neuropathy. So which one? Your teaching should be based on that concept that they have peripheral neuropathy, and therefore, in order to prevent more injury, what do? Pick your answer choice. Which one did you select? Guys, I can tell you, number one is the right answer. Let them wash it. If there's anything there, dirty stuff, infection wound there, clean it. But don't apply lotion between your toes. Fungal will grow, cause problem. You should inspect it for cut redness so that we can treat it early. Wear shoes and socks at all times. Even when you are inside, I want you to wear shoes and socks at all times. Soak your feet daily in hot water to relax muscle. Don't do that. You're going to injure yourself. So these are the things you teach them. And as he's teaching a client with what? Addison disease who's been prescribed steroid to take at home, which instructions should the nurse include? Select or apply. Steroid, steroid, steroid. You got to know how to teach the patient because it causes problem. Take the medication with food or milk. Stop the dose if you feel emotionally depressed or irritable. Have your highs checked at least every 6 months while on steroid. The dose may need to be decreased during a period of stress or illness. Increase salt intake when taking steroid. What do you think? 32. I want you to master this one. What do you think? Which one is appropriate? Include. What are your answers? I can tell you what? That taking medication with food is good because it prevents GI irritation. Stop the dose if you feel emotionally depressed, irritable. You can have psychosis or depression, but abrupt stoppage of the medication can cause adrenal crisis. Negative. Don't do that. Have your eyes checked at least every 6 months while on the steroid. Yes, it causes cataract. So this is good. The dose may need to be decreased during the period of stress and illness, right? No, when you're sick and we want you increase the dose, not decrease it. Wrong answer. Increase salt intake while taking steroid. Steroid will let you retain fluid and sodium. Your blood pressure goes up. If you increase too much salt, your blood pressure increase more. Therefore, wrong answer. A and C are the right answer. This question is intimidating. Don't run away from it. I will show you. Whenever you see it again, you can answer it. And this is caring for a client prescribed NPH. What? Insulin. How much? 4 units. When? Give it twice a day. That's why it's intermediate. And then prescribe sliding scale. If the client blood glucose is 240 at 12 p.m., what action should the nurse take? Hold insulin and recheck it every hour. Give 4 units regular insulin per sliding scale. Administer 4 unit NPH insulin, right? Administer 4 unit NPH and 4 unit regular insulin. It sounds like it's hard, but it's not hard. What would you do? Which answer choice will you pick? Look, NPH is giving BID, right? In the morning, 10 a.m. and 10 p.m. at bedtime. This sliding scale means if your sugar is less than 160, I don't give you anything. If it's 160 to 120, 200, I give you 2 units. 200 to 240, I give you 4 units. Greater than 300, I give you 6 units. And I call the doctor. In addition to the NPH that you've been getting, if it's scheduled, if it's due at that time. So at 12 p.m., patient is 240. Then you look at the sliding scale, 240, it corresponds to what? 4 units. Therefore, I got to give it 4 units. But what? What do you do with the NPH? NPH is not due at 10 a.m. to 10 p.m. This is 12 p.m. Therefore, we give them the sliding scale. So the only answer choice you can give this patient is what? 4 units regular insulin based on the sliding scale. Don't fall for it. They are not difficult questions. It's just interpretation of the table. So that's the one we give them. And this is the explanation about it. Which food should the nurse instruct the client to avoid? About what? A client started taking what? A Finaxin, asks about diet. What do you think we've done? Pharmacology. I have a bunch of pharmacology in adapting class. We did a series. We have a 6-hour video. You can watch it the day before exams and a bunch of questions. Just sit there and then absorb it. But what do you think? Finaxin, I'm asking about food to avoid. Fresh fruits, vegetables, rice and pasta, curried meat and red wine, and chicken and fish. Which one? The way to answer the question is find the medication that we're talking about. I can tell you the right answer is that curried meat and red wine. Why? Why is the right answer? Because Finaxin is MAOI. which what? We should avoid tyramine food. This is not tyramine. This is not tyramine food. This is not tyramine food. A cheese, curried meat, red wine, spaghetti, pepperoni, all those groups, you should avoid them. Therefore, this one is the right answer. So you just have to recognize the medication. Otherwise, you're going to hypertensive urgency. The next suspect what? A client prescribed Digoxin, Furosemide, and developed muscle weakness, irregular heartbeat. What is causing the problem? Hypokalemia, Digoxin underdose, fluid overload. So patient has heart failure. It's on Digoxin and Furosemide. Now he has muscle weakness, irregular. It's a fluid electrolyte abnormality related to this pharmacology. You know what Digoxin does, and you know what furosemide does, right? Digoxin, furosemide work together, but they don't hate each other because furosemide causes low potassium. This low potassium can cause Digoxin toxicity. Patient is showing muscle weakness, irregular heartbeat. It's not because we are under prescribing the dose. It's not because I'm fluid overloaded. It may have crackles or pink fluid sputum. These two, look at it. They're saying something different. Test taking strategy. Hyperkalemia, hypokalemia. That means one of them is the right answer. This is hypokalemia. And then she's teaching the client about mixing NPH and regular insulin. Which statement indicate correct understanding? I know you know how to mix them, but this is a practice run. Just know them. Don't forget them. Sometimes in the exams setting, you forget which one, you know it. Pick the answer, put that in your comment. If you have a formula, how to find out easy way to mix them, put it in the comments so that we all can learn. The way I understand it is called RN, right? So we draw regular insulin first, then N. That's all. But if you have something else, I want you to put it there. Therefore, this is our right answer. A client receiving NPH insulin reported what? Feeling shaky, is sweaty, is anxious 3 hours after breakfast, right? Receive NPH, patient is shaky, sweaty, anxious after 3 hours. That tells you it's a diabetic patient who is shaky after NPH, after the patient eats. What would you do? Give 4 units of NPH, check blood glucose, and provide a rapid-acting carbohydrate if hypoglycemic, or the next insulin dose, administer glucagon immediately. This is full of trap. Which answer choice you pick? It's a prioritization 101. Which one will save the patient life? Ask yourself, how do you answer the question? Go back to what it's asking. Receive NPH, right? Receiving NPH, shaky, sweaty, anxious 3 hours after breakfast, hypoglycemia, rewrite it. All these words is hypoglycemia. If I'm hypoglycemic, would I give you insulin? Negative. Would I check your glucose? And if it's low, I give you some glucose. Would I hold the next dose? I'm not addressing the problem. If you pick this, you are not addressing the problem. Glucagon, the patient is doing what? Math can work. Therefore, I'm not telling you the patient is unconscious. Therefore, no need to give them glucagon. What we can do, assess them, and then give them medication. Which adverse effect should the nurse monitor for? A client is prescribed allopurinol for schizophrenia. Pharmacology. What do you think? Muscle rigidity or tremor, bradycardia, hyperglycemia, and weight loss. What do you think? The major side effect of allopurinol is what? NMS and EPS, neuroleptic malignant syndrome, and extrapyramidal side effect. Therefore, which one would you think is dangerous? Not bradycardia. It may be anticholinergic. Even think about it. Anticholinergic effect is what? Cholinergic, things goes up or go down. It goes down. So when I give you cholinergic, your heart rate go down, right? Anticholinergic would do something different. Therefore, Which one is the most dangerous? It's NMS. Only NMS signs I'm seeing is muscle rigidity and tremor. That's what I care about. And this is teaching a client prescribe INH, which vitamins may be indicated to prevent and treat the side effect of that. The side effect of NIH is what? Peripheral neuropathy. Based on what I've told you, pick an answer choice that can treat peripheral neuropathy. Pharmacology is designed to be straightforward. If you overthink it, you get into trouble. That's why I'm just going straight to the point. I give you the concept. I'm not going to explain it so to complicate things. Take the concept, use it to answer question. Isoniazid, peripheral neuropathy. How do you treat peripheral neuropathy? Pick a medication that can use to treat peripheral neuropathy. You know C and D are not used for peripheral neuropathy. You know folic acid related to what? Hemoglobin related folate level, right? Niacin, unrelated, right? You know, vitamin B6 is what you do. These are all easy way to answer questions. Which teaching point should the next include? Same thing. Don't make it difficult. That's why I make one-line sentence. A client is prescribed sertraline for depression. Which one would you include? Expect full effect within 24 hours. What do you think? Continue medication even feeling better than 1 week? Is that a good idea? Stop immediately if experiencing mild nausea. What do you think? Avoid taking in the morning. One question, no ambiguity. Focus on the key concept and pick an answer. Which one would you pick? Continue taking it, whether you like it or not. Why? It takes time for it to work, 2 to 3 weeks. If you stop it, you're going to have rebound. It causes insomnia, so you take it in the morning. And therefore, the right answer is this. A client is prescribed rapid-acting insulin before meal. Which instruction should the nurse give the client? The key word is what? Rapid-acting. That means what? Administer 30 units before eating. Administer immediately before or with meal. Administer 1 hour after meal. Administer only if glucose is greater than 200. There is some pharmacology questions. The answer choice is right there. Don't stress it too much. The word said rapid acting. Ask yourself, what is the definition of rapid acting? And then you can use it to answer the question. What is the medication going to do? Which answer choice you pick? I can tell you it's that. Why? 30 minutes before eating, the medication will make you hypoglycemic. It's rapid acting. That means there's food and then boom, it attacked it. If I give it to you before you eat, we are in trouble. Immediately, there is food, I give it to you, we attack it. 1 hour after meal, too late. Glucose greater than 200. There's no medication. It's not a sliding scale. Therefore, they're not going to do that. This is your right answer. Which of the following medication should the nurse question? That means something wrong. This is my favorite one. A nurse is reviewing the prescribed orders for a preterm infant, diagnosed with what? Patent ductus arteriosus. Which of the following medication should the nurse question? Indomethacin IV, ibuprofen, prostaglandins, ketoprofen IV. What do you think? Patient has PDA. That's what the question is asking you. Let me break it down for you to pick the right answer. Preterm infant, he has PDA, and we want to close it. That's all he's asking. I want to close it. If it's open, I want to close it. Which of the following medications should the nurse question? That's all. What do you think? You can see there's something common about this. These are all NSAID. NSAID will close it. Prostaglandins will keep it open. Therefore, I should question this. If I have ordered to close the thing, why would I? It's a patent ductus arteriosus. That means I should close it. If I give you prostaglandins, I'm going to keep it open. And that's the right answer. NSAID closes PDA, prostaglandins keep it open. I don't want to keep it open. Therefore, I should question that. Which statements indicate correct understanding of the teaching? And then she's teaching a client who has been prescribed allopurinol for gout. Gout. No allopurinol. What are the concepts I want you to know about it? Let me give you the answer choice first. I may develop a rash and should apply steroid cream to it. I should drink at least 8 ounces of water each day while taking this medication. I should wear sun exposure when taking the medication. I should only take this medication during an acute gout flare. What do you think? What do you think? You need to wear sunscreen. If you develop rash, it's Stevens-Johnson syndrome. It's a bad problem. It causes kidney stone. It causes kidney stone. And therefore, what do you want to do? If it causes kidney stone, you got to drink a lot of water. Therefore, which one is the right answer? I may develop a rash and should apply steroid. When you see a rash, Stevens-Johnson syndrome, you should not do anything. That's a bad problem. I should drink at least 8 ounces of water each day. That will prevent kidney stone. Is that good? 8 ounces of water will prevent kidney stone. Is that good? It's a trap. 8 glasses of water, at least. What do you think? I should wear sun exposure when taking this medication. Is that good? I should only take this medication during what? An acute flare. You should not do that. That's your right answer. We prevent kidney stone. This is lab work. Why? Because this is risk reduction. They love it. Endocrine with a bunch of lab work. But if you look at it carefully, they're actually simple questions. So don't run away from them. I want you to be confident, attack them with strength. A client with SIADH has the following lab: sodium 124. That's what you expect in SIADH. Potassium 4.1, right? Chloride 92 and BUN 12. Which nursing action is a priority, right? Encourage increased oral intake, restrict fluid and monitor for neurological changes, administer potassium supplement, encourage high sodium diet only. You can see after you read it, you can see, oh, this is like a bunch of stuff I put it together to trap you. But SIADH with hyponatremia, how do you treat it? Increase the sodium. Which of these will increase the sodium? That's all. SIADH, fluid overloaded. So which answer choice will you pick? I know you're not going to pick encourage increased oral fluid because they are fluid overloaded. I know you're not going to say encourage high sodium diet only. It will take a while. Administer potassium supplement. It's 4.1. Restrict fluid and monitor for neurological changes because hyponatremia, they can have what? Seizures. A client with what? A client present to the emergency room with vomiting and diarrhea for 3 days. Like I said, these are all fluid electrolytes because it's part of a risk reduction. What do you think? Vitals, 88/52. Hypotension, 128. Tachycardia, respiratory rate, tachypnea, temperature going up. Which action should the nurse take first? Give them antipyretics, start IV fluid, obtain blood glucose level, call the provider for antibiotic. Which answer choice you pick? I can tell you the right answer is what? It's not 1 because then you focus on the temperature. It's 99. It's not that bad. Blood glucose. I never say anything about blood glucose. All these things leading to what? Tachycardia, hypotension. Tachypnea is shock. When you're in shock, what do I give you? I give you fluid because you are in hypovolemic shock. You've been vomiting, having diarrhea. I start IV fluid. Same thing, fluid electrolyte. And nurse is assessing the client 12-hour post-abdominal surgery. Just had surgery. What do you think you should worry about when somebody has surgery? Blood pressure is soft, 102/60. Heart rate, tachycardia. Respiratory, tachypnea. I'm trying to show you something, how to read data. This is what they're going to do in the next few months. They call it what? Rescue what? Thinking. A few information, and then you put it together and you figure out what is going on. Temperature, slightly high. Saturation, 92. Which one is most concerning? This is a good prioritization, 12 hours. Rescue, this is a rescue thinking. You may see it, rescue thinking. If you see the new test plan, you hear them, rescue thinking. You've done it before. I did a video on them. You should watch it. What do you think? Rescue thinking. This patient is in shock, tachycardia, slightly hypotensive, and what? Tachypnea. I'm not worried about the temperature. I don't care about the saturation, 92. It's not dying. Which one do you think is dangerous? Patient and surgery, put it in all. Tachycardia here, signs of shock. Patient is telling you, I'm not doing well. Blood pressure is soft, but it's okay. Don't worry about it. A client with type 1 diabetes reports shaking and diaphoretic symptoms. Blood glucose is 48. Okay, hypoglycemia. The next administered 12 grams of rapid-acting carbohydrate. That's what you're supposed to do. Which of the following actions are appropriate? What is the next thing you should do? The concept here, after somebody has hypoglycemia and you give them 12 grams of rapid-acting carbohydrate, what do you do next? Recheck their blood glucose in what? 15 minutes? If blood glucose remains less than 70, give them another 15 grams of rapid-acting carbohydrate. After glucose is greater than 70, provide a small snack containing 15 grams of carbohydrate and 7 grams of protein. If the next meal is more than 1 hour, give the protein and carbohydrate snack immediately with the first 12 grams of glucose. Encourage the client to rest and recheck glucose in 2 hours. This one, if you reach here 47, I want you to stop it, write the question down again, look at it again. There's a content here. I wanted to teach you. That's why I give you the answer away. This is the concept. This is a teaching one. You don't have to worry about trying to answer it, but otherwise you can stop it. When somebody is hypoglycemic, the first thing you do, 12 grams, 15 grams of glucose. You wait 15 minutes later and check it. That's the thing. Don't do anything. 15 minutes to make sure what you did was effective. If their blood glucose is less than 70, you should give them another 15. But if it's more than 70, then you should give them something to prevent them from becoming hypoglycemic again. That's what? 7 grams of protein plus another 15 grams. You see? Give the protein and carbohydrate snack immediately. No, you got to check their glucose 15 minutes later. Encourage the client to rest and recheck glucose in 2 hours. You're going to kill them. So that's the concept. 47, mark it down. And this is planning care for a child with sickle cell disease. I have 3-4 sickle cell questions because I think it's very important. Which intervention help reduce infection? Why? You want to prevent acute coronary syndrome. Therefore, which one will prevent infection? Select or apply. Give them penicillin prophylaxis. Ensure their immunization is up to date. Teach them hand hygiene, infection prevention. Limit all exposure to other children. Monitor for fever and report promptly. 48. Which one will reduce infection? Of course, give them penicillin prophylaxis. Is that okay? Yes. Then what? Immunization. It's not bad. Anybody who are at risk of infection, yeah. And hygiene, the best way. You can limit all exposure to other children. Now, you're going to isolate them. Monitor for fever and report promptly, prevent infection. And then receive order to provide what? Approximately 7 grams of protein to a client after treatment of hypoglycemia. That's the content we learned. I told you we got to give them 7 grams of protein to prevent them from going to hypoglycemic state again. What does 7 grams of protein means? Which of the following diet choice should the needs include? What does that mean? 1 slice of cheese, 1 teaspoon peanut, 1 cup of milk, 1 small apple, 1 slice of white bread. How do you answer this question? Even if you don't know what is 7 grams, the key strategy is what? Pick your answer choice first. You pick it now? I'll give you 2 more seconds. Okay. Look at the answer choices and see which one has protein. I see a slice of bread. This is all carbohydrate. Small apple, carbohydrate. Both of them gone. Milk, yes, protein. Peanut butter, protein. Cheese, protein. That's all. That's how you answer it. And this is 7 grams. You can take a picture of it. And this is carried for a client with sickle cell. Which of the following are signs and symptoms of acute chest syndrome that the nurse should monitor to reduce risks of complications? Select or apply. Sickle cell patient can have acute chest syndrome. Let me show you the pathophysiology. There's less blood flow, right? Due to vasoactive disease. And then the bone, no blood going there. It becomes ischemic. Then when the bone die, the fat globuli embolize to their chest. And so they have mostly chest symptoms. This is acute chest syndrome. Therefore, what is the definition of acute chest syndrome? I'm supposed to see things about chest. Chest pain, even if I don't know it. Cough, it's about chest. Shortness of breath, it's about chest. Headache is not chest. Even if you don't know fever, it's one of them. But you don't have to pick it. You can pick, say, based on the concept. Use the concept to answer the question. That chest, chest, chest. I picked 3 chests, but I can tell you the other one is part of it. And this is caring for a client at risk of stroke. Is going to get stroke. Which of the following intervention and assessment are appropriate to reduce stroke risks? Somebody is going to have stroke. How do I prevent it? Monitor their blood pressure and maintain within target range. Encourage low sodium, low salt diet. Assist the client with smoking cessation. Administer aspirin as prescribed for primary prevention. Encourage prolonged bed rest to prevent fall. What are we doing? What are we doing? Risk reduction. How can you prevent stroke in this patient? Health promotion. Maintain the blood pressure. Low salt diet. Smoking cessation. What do you think? Aspirin as preventing primary. Prolonged bed rest. You're going to have DVT. Bad problem. 52. Last risk reduction question. And this is caring for a client with sickle cell disease, which action help reduce the risk and severity of vaso-occlusive pain crisis. Which one? That means which one? When they go into vaso-occlusive pain crisis, that means the blood become there's the sickling of the sickle cell, they clog the vessel, and they develop vaso-occlusive pain crisis. Every organ is in trouble. So how would you reduce it? Hydroxyurea, is that what we use for? Think about it. Encourage oral and IV fluid. Avoid routine use of what? Analgesic for pain. Educate on avoiding extreme temperatures. Promote smoking cessation and stress management. What do you think? Stress management. Extreme temperature. They need pain medication, fluid intake, and this to prevent recurrent. You don't use it in acute situation, but you can use it to prevent when they get it. So that's very important. It decreases sickling episode. Hydration reduces blood viscosity. Extreme temperature can trigger vaso-occlusive disease. Smoking cessation, stress management avoided. Which I love these questions that is coming. If they are challenging, it's maternity. Good luck. Because Adapt NCLEX got you. If you need maternity, I've been doing a bunch of videos on maternity just because I've got so many emails about them, and I decided, okay, every week I'm going to drop one for you so that you can be comfortable. Check my YouTube channel, bunch of maternity. Which fetal heart pattern should the nurse expect to observe? Why? A nurse is observing a client in preterm labor who has what? Received terbutaline. Do you see bradycardia, tachycardia, late D cell, variable D cell? Don't run away. Go for the buzzword. Stop the video, answer it, and I'll help you through. You pick your answer? Good. Let me show you how you can answer this question so easily. It's a fetal heart pattern, okay? Terbutaline, okay? What is this? It's a beta agonist. Beta agonist, it speed things up like Albuterol. It make things goes up, but it make your uterus slow down, preterm labor. Therefore, you're not going to see bradycardia. You will see tachycardia. It doesn't affect deceleration because it causes tachycardia. It does not cause what? Variable deceleration. And even test taking strategy, even if you don't know, this is deceleration, deceleration, deceleration. I see one acceleration. That's my right answer. This is the way you answer questions. You got it, and Adapt NCLEX got your back. Fetal heart monitoring, tracing. This is key. I will show you how to recognize them. A nurse is monitoring a client in labor when a sudden change in fetal heart rate pattern appears on the monitor shown below. Which condition should the nurse suspect? Fetal head compression, placenta insufficiency, oligohydramnion, maternal fever. This is what you got. Boom. All of a sudden, boom, something is going down. That's fetal heart rate. It's forming like a V. That's the clue. If you see V in the fetal heart rate when the mommy is contracting, what do you see? What do you call it? A sharp V, sudden drop in the V shape. This is what? Variable deceleration. What condition causes variable deceleration? What do you think? It's called compression because there's no fluid, or oligohydramnion. And compression, that's not going to cause that because it's what? What do you think? Placenta insufficiency, what do you cause? Maternal fever causes tachycardia. Therefore, this is the right answer. Placenta insufficiency causes late deceleration. That's what you see in that. And then head compression causes early deceleration. So this is oligohydramnion. Same thing. Which action should the nurse take first in a laboring client receiving Pitocin infusion with the fetal heart pattern? This is what you have. It's what you see. Mommy is receiving Pitocin, and you see this. What do? Decrease the Pitocin, place the client in a lateral position, administer IV fluid, stop the Pitocin infusion. What do you think? This is what you have. The best way to read them, always look at the maternal one. You should see 5. Anything above 5 is tachysystole. If it's more than 5, stop the Pitocin. This is tachysystole. Stop the Pitocin. Don't decrease it. Another strategy, A and D are saying opposite. So I'm going to pick it. These are read fetal monitoring. It's not that hard at all. You just have to master them. And nurse is caring for a client with preeclampsia. Which finding is most concerning? Hyperreflexia, epigastric pain, headache, and facial edema. I love this question because It's easy to trap you. You pick your answer? Which one you pick? Short answer, not the long one. You don't need a long one. Short, straightforward. What do you think? Preeclampsia. Which one did you pick? Did you pick hyperreflexia, epigastric pain, headache, facial edema? Preeclampsia, I expect facial edema. Don't worry about it. Headache, you should expect some of them. It's part of the problem. Hyperreflexia, I don't like it. It's dangerous because what? In preeclampsia, when things are going up, it means you're going to have seizures. Hyperreflexics means you're about to have seizure. And if there's clunus, you're more likely to have seizure too. That's why we give you magnesium to decrease your reflexes down. So I'm worried about this. But if you develop epigastric pain, you probably have what? Herpes syndrome. It has affected your liver and you're going to go deadly situation. Therefore, this is one. This can be a right answer. They can change the answer. If I put hyperreflexia and clunus, that's bad. The patient's about to have seizure. This one is already okay. So that one is the right answer. That's what I explained here. Epigastric pain indicate hepatic involvement and possible herpes syndrome. Signaling impending eclampsia, liver failure, right? Liver failure. But clunus and hyperreflexia may indicate seizure. The only thing I said was hyperreflexia. There's no situation where you got to pick it unless I put clunus there, that will become a priority. And this is obtaining intake history of a client who is what? 34-week gestation at an outpatient clinic. Which finding is most concerning? She's 34 weeks. Which one you should worry about? Fetal heart is 110 to 130. Report 5 fetal movement in 2 hours. Cervix is closed. There's bluish coloration of the vaginal wall. Which one should worry you? Baby moving, the cervix is closed, the fetal heart rate is that, and we have blueness in the vagina. Blueness in the vagina is expected. We don't want the cervix to be open, it's fine. Baby heart rate is within normal. You need at least 10 contraction in 2 hours. Baby movement, 10 movement. If it's less than 10, we got to let the doctor know. Nagel's rule. I know you can calculate it. What is the charge? What is the client estimated date of delivery? And this is triaging a client at OB clinic who report a last menstrual period occurring between January 1, 2026, January 7, 2027, 2026. The client believes she may be pregnant. Use this Nagal rule to calculate it. What do you think? Estimate date of delivery. I know you know how to do it. You may have your formula, but the easy way is what? A menses start the 1st and ends with the 7th. Therefore, how do you do it? You take the starting one, not the end date. You start January 1st, add 7 days. That's what? January 8th. Subtract 3 months, it will be October 8th. That's 2025. Then add 1 year, we're back to 2026. October 2026, 8. Therefore, this is gone, and this one is our right answer. So that's the way you calculate it. If you have your method, use it. And this is the rule. First day of the last menstrual period, add 7, subtract 3 months, and then add a year. We come back to the same year. What do you think? Which form of emergency contraception should the nurse anticipate the provider to discuss or prescribe? We still on maternity. I'm trying to go through all the things you need to know, the pharmacology in terms of contraception. A 25-year-old client present to the OB clinic 4 days after unprotected sexual intercourse. 4 days, and they need emergency contraception. Do you give them IUD? Do you give them Plan B, levonorgestrone? Or you give them combined oral contraception, or you give them depot injection? Write this down. If it's within 48 hours, Plan B. If after 5 days or more than 72 hours, you give them copper because it's long lasting, it's forever. These guys will take forever to work and it was not effective. Either you get plan B within 72 hours, after 72 hours, you get a copper. And that's the key concept here. Which intervention are appropriate to include in a plan of care, considering the client's growth development need? Select or apply. What do you see? PIDs. Everybody is run away from PIDs. Growth and development. Know it. 16-year-old is admitted for what? Appendicitis. What would you include to ensure growth and development? They always will tell you, do things according to their age group. 16-year-old child is admitted for what? Appendicitis. 16-year-old adolescent. Which intervention are appropriate to include in the plan of care considering the client growth and development? Do things to improve growth and development. That's all. Do you encourage the client to participate in decision care, or you want to isolate them? Do you set a step out to provide privacy when they're taking care of themselves? Involve their parent in every little decision? Do you explain appendicitis procedure and medication? Do you limit peer interaction during hospitalization for faster recovery? What do you think? Pick up your answer choice and let me know. But I can tell you, you should not limit interaction because they like to be among their friends, adolescent. Wrong answer. Be honest, explain everything. They want to know in detail. That's no matter. Parent, don't include them in the decision, every little one. Provide some privacy and let them participate in their care. That's what you do for adolescents because of autonomy, self-esteem, and all those things. Which action by the nurse is most important to prioritize? For what? A nurse is conducting a well-child visit for a 2-year-old. Which of this is more important when you see a 2-year-old? Assess whether they're growing, growth and development milestone, whether they get their vaccination, teach the parent about healthy nutrition, discuss toddler safety and injury. This is all trap. Look, I know there's a bunch of stuff that has happened in our country recently, but look, this is it. 2-year-old. Which one would you pick? Injury and safety, nutrition, vaccination, and what? Growth and development. What has saved us in the past few years is that you can't run away from it. Vaccinate the kids, vaccinate the kid, vaccinate the kid. That's all. This is what is going to prevent diseases that we never heard about. If you don't, well, good luck with that. This is the answer choice you should pick, no matter what is going out there. Always appropriate vaccination based on age. Which action is most important to prioritize? And this is caring for a client diagnosed with what? PKU. Whenever they said prioritize, figure out what is the most important with PKU. Is he instruct the family to provide low phenylalanin diet using special formula? Encourage the client to increase protein intake with lean meat and dairy? Monitor the client for signs of B12 deficiency? Schedule routine neural development assessment. What is the major thing about PKU? They cannot digest certain protein. What is that? Phenylalanin. Therefore, what? They get sick when they eat protein. Therefore, what? Give them something that there is no phenylalanin. Which one you should prioritize? Neural assessment, we'll do it later. And this is assessing a 2-year-old child going for a well-child visit, which finding indicate the child is developing on track. It's a 2-year-old. The way I study what? Growth and development. When I see a 2-year-old, every answer choice, I'm looking for 2, 2, 2, 2. You can stack 6 or 7 blocks. There's no 2 there. Okay, I'm not 100% sure. Kick a ball. It can stand. Therefore, it can kick the ball. Can name at least 2 parts. Hey, I see 2. I pick it, my friend. Right? That's the one I'm looking for. I got 1. Follow 2-step command. I get another 1. Show parallel play. What? Parallel play 2. One on the other side, the other on the other side, but they are not communicating with each other. They play alongside each other, but they are not involved. But they can stack 6 to 7. Even if you don't know, you can leave it alone. But those are all things they can do. And this is a strategy to help you safety. NCLEX love safety. So you can take a picture of it so that you can know specific safety requirement for each age group. And this is providing safety teaching to parent of a child. Match each safety teaching with the appropriate age group. Infant, toddler, preschool, school age, adolescent. What is the key? Rear facing car seat, install safety gates, stranger safety, internet safety, and sports safety. Match them. You match them? Which one? Infant, car seat is our problem. Toddler? Well, what do you think? Gate, so that they don't fall. Preschool, stranger, they don't get snatched away. School age, internet. And adolescent, sports, you get injured. This is just to give you all the contents that you know so that you become comfortable about safety. What is the most important? So that when you see a safety question, is what it is. Which erection stage does the behavior represent? 2-year-old, we saw about a 2-year-old, what they can do. What is he insisting? Choosing their own clothes. They said they want to choose their own clothes, no matter what. Even if they do not match, I want to wear this. I want to wear. Which Erikson stage does the child represent? Trust and mistrust, autonomy and shame and doubt, initiative and guilt, industrial and inferiority. What do you think? He said, I want to wear it, whether you like it or not. I want to wear it. It's me. Which answer choice say me? Industrial inferiority doesn't say me. Initiative, you're trying to do something, nobody's preventing you. Autonomy, hey, I want to do it. Mistrust is young one. They are not that. So that's the one. And this is assessing a child at the clinic. The parent report that the child play mostly involve pretending to be Cinderella. You want to be a Cinderella and act out the story with toys and drawing. That's what he does. You see, that's NCLEX, adapt NCLEX practice question Q bank. This is the way you can see how this is very lively. And if you like this video, put the like button down and say thank you for this video. Good luck in your exams. Thank you for staying around too. 66. I'm happy for you because I know you learned something. And this is assessing a child at the clinic. The parents report that the child play mostly involved pretending to be Cinderella and act out the story and toys and drawing. Which age group is that? It's a pretend play. Who does pretend play? That's all. Toddlers, parallel play. That's not pretend play, right? School age, they start dealing with associate play, right? Infant is what? Solitary, so preschool. That's the way you go. You see, peds I love peds, right? Now we get into mental health concept. We did a case study, but now mental health concept. The client say, I want to tell you a secret about something I did last night. What do? You are the nurse. This is what the client said. Which is the best nurse response? You can tell me anything. I won't tell anybody. Oh, is that good? I'm here to listen, but I must report any unsafe behavior. What do you think? Don't tell me. It is not important. That means I don't care. Tell me and we'll keep it between us. Hey, you got to set boundaries. Therefore, I will listen. If it's bad, I got to tell people. The client admitted for mania is yelling at the staff and throwing objects. This tell you is a safety question. Which is the priority intervention? Every mental health case, always think about safety. Offer a PRN sedative immediately. Place the client in seclusion or restraint. Remove potential weapon and ensure safe environment. Confront the client about their behavior. Every mental health question, think about safety. Patient has mania, yelling and throwing objects. Which answer choice is safe? Which one you pick? Which one did you pick? Potential injury. A client with schizophrenia tell the nurse, the voices are telling me to hurt myself. Bad. Safety. Which statement is most appropriate? I'm here to keep you safe. Tell me what the voice are saying, trying to find the content of the issue at hand. Don't listen to the voice. They aren't rare. How do you know they are not rare? Everyone here thinks sometimes it is normal. The patient said, I'm going to hurt myself. Ignore the voice and focus on your breathing. Always find the content on auditory hallucination. Therefore, which one is the right answer? Tell me what you're hearing. And let's enter a psychiatry unit and note the client clenching fist and pacing angrily, right? Trauma problem. Violent. Which is the best immediate action? Approach the client and ask why they are angry. Would you want to do that? Confrontation? Move other client out of the area and call for help. Ignore the behavior and document it. Tell the client to calm them down immediately. I try to create a bunch of safety questions, so because it's a safety answers, so that and the safety test, so that you can be comfortable picking them. And you know the right answer is staring at you, popping like a candy. Which one is that? What do you think? Which one is that? Move the other client away. A client with anxiety disorder states, we are on mental health what? Concept. I feel like I can't breathe, right? I'm going to die. Which response demonstrate therapeutic communication? Patient said, I'm going to die. I have anxiety. Help them. Which one? Calm down. You are fine. Wrong answer. Don't worry. It will pass. Wrong answer. What do? Find more about it. Ask them more about it. I understand. Everyone get anxious sometimes. Is that okay? Trying to generalize it. Tell me more about what is happening right now. No brainer, right? That's your right answer. A nurse is caring for a client admitted with what? Major depressive disorder or report feeling like life isn't worth living. Suicidal. What is the nurse priority? Figure out why they're saying that. What answer trace do you look for? Tell me more. Sit quietly with the client and listen. That's maybe tell me more situation, right? Look like tell me more situation. I don't know. Ask the client if they have a plan for self-harm. Much better than the other one, right? Notify the family about the client feeling. You have not talked to the client. Encourage journaling about feeling. It's not enough. You are ignoring the statement. Therefore, sitting and listen versus acting. Tell me what plan you have. Better. Which of the following findings are consistent with depressive symptoms of schizophrenia? And this is assessing the client with what? Schizophrenia. Hallucination, delusion, plaque affect, social withdrawal, disorganized speech, catatonia, grandiose thought, increased energy. I can tell you D is bipolar. It's not one of them. Now, depressive moods, things are going down. Delusion, hallucination, positive symptoms. Plaque affect, social withdrawal, sound like I'm going down. Disorganized speech, that's outgoing. This is catatonic. So this is it. And the last question is a case study. I save it for the last so that you have 2 case studies. Are you ready? Let's get to it. It's a straightforward. 65-year-old male with the history of hypertension, coronary disease, present with what? Shortness of breath, atopnia, and deny any sick contact. The new test plan, they said they will give you some few information and then you have to figure out. They're not going to give you a bunch of information. This is one of them. You have to figure out. 65, I have hypertension, coronary disease, shortness of breath, atopnia. What is going on with him? Heart disease, hypertension, is having respiratory problem. Look at the heart rate, 116. Respiratory rate, 30, bad problem. His saturation is going down. You got to figure out, I've not given you any information, so many things. You listen to them, crackers, and they have class 3 edema. Some CHF symptoms, they're on lisinopril, furosemide, and aspirin, and methylprednisolone. You figure out heart disease, hypertension, having respiratory problem, look like they're fluid overloaded. What do you want to do? The nurse has reviewed the clinical data. Which assessment should the nurse perform first to further evaluate the client condition? What do you think? Do you listen to their lungs? Do you weigh them? Do you check their urine output? Check their pico pulse, their digoxin, pain scale, and mental status. Of course, I got to know mental status. Respiratory rate is going up. All these things make me worry. Saturation, are they awake? They tachycardic? Are they in shock? I got to check the pico pulse. Is that so? Is that so? I don't need it. I got to check their urine output to know if they are fluid overloaded. Are they getting cardiac output? You need a daily weight. And the lung. I've already given you a pulse. The pulse is 116. Why do you want to check it again? Which two prescriptions should the nurse implement first? Select or apply. Do you give them oxygen? Furosemide? Check their weight. Normal saline at 125. High follow position. Look at it. Saturation 86. Tachypneic 30. Lungs sound crappy. What do you want to do? If you got to choose two, oxygen, laces, furosemide, weight, give them normal saline 125 an hour, high follow position. I can tell you, furosemide will take some time to work before you get it. Easy way, put them on oxygen and high follow position. The nurse has received the following orders. Normal saline, 1 liter over 30 minutes. That means bolus. IV morphine, IV furosemide, metoprolol, and potassium if the K is low. Which prescription would you question? Do you think this patient need a liter over 30 minutes? You think they need morphine? You think they need furosemide, metoprolol, and potassium? I can tell you, you should not bolus them. They're already fluid overloaded. You should hold a beta blocker, right? That's not going to help them at this time. Blood pressure is a little bit soft. Look at the blood pressure. You're going to drop the blood pressure. So we should lower it. Potassium, if they said they give you parameters. If the potassium is low, we can give it. Morphine, why do you give morphine? What do you think? When somebody is having respiratory issues, sometimes morphine can be given. But morphine is given based on what? Their respiratory rate. If they tachypneic, you can slow them down. But if the respiratory rate is already like 10, 12, if you give them morphine, drop them more to like 5, they die. Respiratory rate of 30 will make them less anxious. When they're less anxious, they take a slow, deep breath, and now they can get a full breath. That is the concept associated with morphine used in respiratory situation like this patient who is having CHF and a pulmonary edema. You can slow them down, so you don't need to question it. Now, what is the point? Indicate if this is the value. We have a BNP of 180, sodium 134, potassium 3.1. That's the live value. Indicate if this is expected, require to monitor or notify the provider. So BNP of 110, 1800 is because it's an expected finding in CHF. A sodium of 134, we just need to monitor it. And a potassium of 3.1, we should let the doctor know. After furosemide, that means we give them loop diuretic, they pee 100 ml over 4 hours. That's good. Their weight went down. Their lung now less crackles. Saturation is now better on 2 liters. Blood pressure is improving, which finding indicate treatment is effective. You can see all lung problem. Pick the long one. And nurse is providing district teaching to the client with heart failure. Which of the following instructions should the nurse include? Select or apply. What do you think? Monitor your weight and report sudden weight gain. Follow a low sodium diet. Restrict fluid as prescribed. Avoid NSAID. Call the provider if you gain weight too fast. Take extra diuretic if feeling short of breath. Select or apply. You don't have to pick everything. Pick those that you're 100% confident. But this is your last question. Thank you for playing. Thank you for watching. Thank you for being a subscriber for Adapt NCLEX. If you're a member, thank you for being a member. If you want to join our membership, it's a small token to help our channel grow. So you just see a video, just click membership or join, and then there's some restricted videos you can watch. But this is Adapt NCLEX. Thank you. Which one we should include? You got to monitor your weight, follow low sodium diet, restrict fluid as prescribed. If I say 2 liters, stay with it. You should avoid NSAID. You should call when you gain too much weight. Don't overtake diuretic if you are not being instructed to do that. 85 questions, NCLEX practice question, NCLEX review questions on what? Pharmacology, maternity, risk reduction, endocrine, peds nursing, infectious control, prioritization, delegation. We went through everything that you need for your NCLEX, including mental health and next generation NCLEX case study. Thank you for watching and good luck. If you need more, subscribe to Adapt NCLEX. If this video helped you prepare for your NCLEX, a small token of what? Comment in the comment section will help the channel grow. Thank you very much and take care of yourself. Bye.